I'm Victoria Cobb, president of the Family Foundation. We are thrilled you are here. Some of you have been a part of this long series we did mostly during the actual shutdown portion of COVID, sort of from March to June time period. But we've done a few since then, this VIP chat where we bring on some folks that are really either experts in their field or specifically some elected officials that can speak to some pressing issues of the day. And so we're thrilled to be back because we think we have a pressing issue of the day. Parents across Virginia think there's a pressing issue, and that is what is going on with the education system in this moment? How do we adjust? What are the right and wrongs, if there are any, in this moment? And so we're thrilled. Today's guest is going to be amazing. What I'm going to do is just make some opening announcements, and then I'm going to turn it over and get right into the heart of the conversation. But just by way of some Family Foundation things that are going on, for those of you that are zoning into us today and maybe don't know about these things, I want to make sure you know. The first thing is that we do have a petition running on our website regarding what we call the snitch line. If you've paid attention, we now have in our government motivation for citizens to rat out businesses that might not be, in their minds, doing COVID the way they think it should be done. We have an example of a business where they theoretically didn't have enough signage, although they had 6 signs, and got snitched on, and the next day the health inspector showed up. So our goal is to kill the whole snitch line, but at the very least, try to move towards some penalties for false snitching and so forth. So anyway, I encourage you to go to our website and sign up for that. We also have another VIP chat type event tomorrow, if you're game for another one of these, but it's specifically geared towards churches and schools, and it addresses how do I operate my faith-based ministry, particularly those are the ones that are going to be affected in light of the Virginia Values Act that has now passed and impacts very much the hiring and firing, the public accommodations, what do you do with your facility in light of issues with sexual orientation, gender identity. That already has incredibly high registration, and so if you are a person who administers a school or a pastor, feel free to jump on with that. And hopefully you received an email from us on that. The other thing I will say is there is a lot of activity going on with our C4. What does that mean? That's a legal term, but the Family Foundation Action, the more political side of what we do. I'll just make a couple announcements there. On Saturday, every Saturday during the summer, we were having the Summer Speaker Series, which meant that various candidates for office sponsored an event so that they could speak to our audience. And our goal with that event is to get folks to show up and learn about how important the upcoming election is that we are focused on in the 7th Congressional District, and get folks ready to be equipped to door knock, make phone calls, and be a part of this effort. And so this Saturday, we have one of these 7:30 in the morning for our early risers to come out. We'll have speakers. It is sponsored this time by Amanda Chase, and then the head of Citizens Defense League, a gun organization, is also going to be a part of this event. So it's just a chance for people to hear. I think folks want to hear from all these kind of candidates and learn who's in the races and what do they stand for. So she sponsored that event. That is tomorrow. If you're interested in that, we certainly want you to be a part, regardless of whether you go to these events, be a part of this effort to take back the 7th Congressional District for a conservative, to get values that we believe in back, representing at least this portion of Virginia. And so that's important. The other C4 event I'll very briefly mention is just a general effort in door knocking. And we're actually kind of encouraging folks to engage in a specific effort we're about to start, which is addressing the over 13,000 potentially conservative people in the 7th District, Henrico and Chesterfield specifically, who are not registered. So we're going to be working on that. If you have a willingness to work on some homes to get them registered, we'd like you to be a part of that. Contact for any of these efforts, contact Britton at familyfoundation.org. And then we're doing one event out in Charlottesville, which is not the 7th if you're kind of zoned into the map of Virginia, but we're doing an event out there because the folks out there are rallying for the 5th. And so we are trying to build some grassroots in the Charlottesville area. So we're having a kind of a combined event that will be on September 10th. So if you're out in that area, you'll be able to get the information on our website. You can also just email Candy at Family Foundation, and she can give you all the details. But it's going to be an awesome event. Bob Good is a candidate for the 5th District, and he's going to be speaking. We're going to be talking about the grassroots effort we're trying to build there. So if you're from that area, I wanted to make sure you knew about that as well. So knocked out all the announcements. I know we really want to get to the meat of this discussion, so I don't want to hold us up. The last thing I'll do is just tell you how this works. So if this is your first VIP discussion, we're glad you're here. We do have everyone muted. And our goal is that if you have a question, you have the ability to put that in the question box on the right-hand side, and that will go directly to the folks, to Todd Gackey, who is our Director of Government Relations. He is going to be interviewing today Senator Dunnavant, who happens to be my senator in the 12th. But even more than that, she's a medical doctor, and so she brings a really unique expertise to this moment. So if you have a question as they talk at any point while they're talking, go ahead and put it in the question box, and then they'll filter through those at the very end, kind of get to the questions that they can. There may be a case where they can't get to your question, and we'll still try to get that addressed after the fact. But that's your way to kind of engage and get whatever you're thinking about as part of this forum. So with that, I'm going to step out of the way and get excited because we're going to bring on Todd Gackey, our Director of Government Relations, and Senator Dunnavant, who's just done an awesome job representing many of the things that we care about and is really polished on this issue of the moment that we're in, how do we handle the pandemic, and what do we do about our kids? So thanks so much, and I'm going to step out.
All right, thank you, Victoria. Senator Dunnavant, it's great to see you. How have you been doing this summer, I guess since session adjourned back in the spring?
Good morning, afternoon, Todd. I am doing well. I'm busy. You know, as soon as I got out of session, a week later, everything pretty much shut down. And we were always seeing patients at the hospital because babies come no matter what. And so I was there, but for shorter times, and really immersed myself in figuring out what was going on with COVID. Where's the data? At that time, there was no data. And figuring out how we could begin to add some sort of expertise to the discussion because everybody was so scared. And that's kind of what doctors do, is they look for data that applies to the situation, and they use that to help people be reassured and find solutions. So we've been doing a lot of that, and of course I have later then turned very specifically to education that we're going to talk about today, because I was so frustrated that the data doesn't support the actions that have unfolded.
Yeah, we have a lot of parents, a lot of families that are very interested in this topic. I as well, we have 4 kids ourselves in high school, middle, and elementary, so we are really navigating this new learning environment. So let's go ahead and dig in. My first question is, you know, Becky Pringle, the newly elected president of the National Education Association, last week said the federal government is not providing the leadership to ensure schools are safe to open. That's her opinion, of course. For those parents in Virginia who've decided to send, or maybe still considering on sending their children back to in-person school this fall, can you speak to those parents? Are they, regarding their safety, how safe are they when they do return to the classroom?
So, you know, whenever I hear a statement like that, immediately my mind is filled with questions. How so? How so is the federal government not doing what they should be doing? And so, as we all know, schools are local. In Virginia, the Constitution protects the 132 school boards that we have, specifically from the state intervening. And the only pull that the federal government has is the funding that they send to the public schools. But with that, they still can't control decisions of the school board about opening and closing. You know, the federal government is not where my expertise is. Mine is more in Virginia, and you can only keep tabs on so many things. But I'll tell you this, Virginia has abysmally failed to communicate to schools what they need to do to protect our children. And this particular issue is so easy because the subject matter experts that we have here is the American Academy of Pediatrics. And they are, you know, when I hear that statement at a federal level, it's clearly political. She is disparaging the performance of the federal government. We're in an election year, no specifics, no examples, no solutions, no help at all. And I would suggest that if the American Academy of Pediatrics were to be given a political label, it would be that they take a lot of very liberal positions, and to my discomfort. So for that organization with that political prism to come out and say so definitively that the risk for our children, the relative risk of not opening schools, vastly outweighs the relative risk of COVID COVID-19, that is all I needed to hear. And so based on that evidence, and they have a lot of detail, they have a lot of data, they reference a lot of studies, all of which we've been following as this goes along to support their assertions. They support their assertions with data. And so to that end, it shocked me that the state government thought in their infinite wisdom as bureaucrats, they would be able to develop better guidelines than the AAP to direct our schools on process as opposed to concept. What the state should have done, what the governor should have done, is he should have come out and he should have said, find a way to open schools safely for children and for adults and teachers. And that is your mission. Go figure out with all the best evidence we have how to do that. And he didn't. He said, take these obscure conflicting guidelines that are going to derail you and make it impossible for you to solve this problem, and go find out how you can comply with our regulations as opposed to how you can do the right things for kids. And so that what I see is our state government offering the worst advice they could have to the schools about what we needed to do this fall.
Okay, so for these school divisions that are going to allow in learning in the classroom, there's a lot of certain health and safety requirements that they're going to follow. One of them is including that students wear masks for the entire day. I know that really scares our kids. You might be used to it as a physician, but can you just kind of touch on what some of the reasonable protections that schools should put in place to protect our children when they do return to the classroom?
So there's two things that we need to talk about, two different perspectives on this issue that we need to talk about. And what does the science say? And the science says, what does the science say? What does the evidence say? And then what's a practical reality? And so the science tells us that this virus is communicated not airborne, not floating on the air, but in droplets. And the whole reason 6 feet was brought up is that droplets are heavy. They fall through the air. And if you inadvertently spit from your mouth or, sneeze, that droplet's going to fall to the ground before 6 feet. So if you're 6 feet away from that droplet, you're safe. Masks catch droplets. Masks do not protect the wearer. The way that you protect an individual from contracting COVID is to use great cleaning techniques and to use great hand washing. And so masks are something that protect the surrounding people, and the evidence is mixed. For most people without a health issue, wearing a mask is inconvenient and uncomfortable, but not a big deal. And I will say, and so, the data isn't resounding on either side. Both sides think they've got the conclusive data. You don't need to wear masks. You do need to wear masks. The answer is we're not really sure, but we do know that they catch droplets. What does our experience tell us? What does evidence tell us? Our experience and evidence tell us that 60% of our child care centers have been open for the entire course of COVID-19, so that essential workers had a safe place for their kids to be. Those are centers that have not been able and never attempted to socially distance the children. And in fact, those centers will tell you that social distancing is developmentally inappropriate for children. But they haven't done it. There hasn't been mask wearing. There's been an interaction between children and adults. There have been only one outbreak that was tied to a child care center in all that time. And with that outbreak, there were cases, but there were no hospitalizations and no deaths, thank God. So the evidence that we have is that even if kids don't wear their mask all the time, they're okay. And if you look back at a little bit more of that deep dive on the American Academy of Pediatrics, that's because we know kids respond differently to this virus. They have different levels of passive immunity that already exist. They don't seem to get sick. If they get it, they may not be symptomatic, and they often don't even get it. But more importantly, children are not vectors to adults. And this has been substantiated in several different studies. So when you look at the flu, kids get the flu and they give it to everyone around them. This virus is not transmitting that way. This virus is transmitting more within age groups. So kids are not being the vector to the adults, either the teachers or the parents when they go home or anybody else in the home, as we thought they were. So the final piece of discerning what we do about this is the practical reality. Because there has been such a failure in communicating how to understand what is happening, where we are, and where we can practically go, there is an inordinate amount of fear right now. And mask wearing psychologically makes people feel like they're doing something proactive to be safe. And there's some science to support that. So I think in a way, mask wearing is a trade we need to make in order to get back to more normal interactions, especially for our kids. Kids are incredibly adaptable. I know there are other locations that have had their kids wear masks just over the summer and in other situations, and the kids have adapted really, really, really well. And so I would say to parents, if your child has a particular health risk, figure that out, talk to the doctor, talk to your school. But other than that, make it fun for your kids. Make hand washing fun for your kids, because that's the most important thing. But make this something that's not a big lift. Let's just do it.
Okay, that's great. All right, so let's get into this reopen versus full virtual learning. All right, so you've joined with some of your colleagues in the General Assembly to advocate for children to return to in-person learning this fall. And you've already kind of touched on that a little bit. Can you explain what your expectations are and how you came to that conclusion?
So I came to the conclusion resoundingly based on the advice of the American Academy of Pediatrics that did a very, very well thought out analysis of relative risk. I mean, this is medicine. You might have two different ways you can treat a patient, but you have to look at what's the good of the outcome and what's the relative risk of each, and fully disclose all of that and share it. And when you look at school is not curriculum. Curriculum is what you put into virtual learning. And there's some didactic and there's some synchronous and asynchronous interaction, but curriculum does not equal schools. In Virginia, we have made an investment in schools as buildings, as a place where we have not only curriculum, but we also have screening and support systems and relationships and counselors. And even in many cases, nurses and others that are there we have food. 40% of the children in Virginia are on free or reduced lunch. That means that their families meet financial criteria for us to pay for their food. Do you think they have money to find a safe place for their children? 35% of our kids in Virginia are on Medicaid. So the idea that school is almost as good if you give it virtually is absolutely inaccurate. So that is not been discussed by the media or a lot of other advocacy groups. The idea that we're not protecting teachers well enough by returning to school is also, I think, faulty. Number one, we've just had a conversation about the transmission rates. We have great evidence based on kids and adults interacting for a long period of time. And so there's no scientific evidence or experience to support that position either. How we've all asked the question, how are teachers different than any other essential workers? What is more precious than making sure the children in Virginia have the opportunity to be educated? We've all discussed the education benchmarks. If kids aren't reading by third grade, and I guarantee you that the kids in first, second, and third grade right now are in jeopardy of not reading on grade level. If they're not ready for algebra by 8th grade, if they're not hitting the benchmarks of success and achievement, we are abandoning them to not having power over their own future, and it's egregious. So for all of those reasons, I have advocated that schools open. And I find it so puzzling because I look at Henrico data, and when they surveyed the teachers, and those are public and publicly available on HCPS, the teachers said 91.7% would return to school when it opened. So they do have a workforce. I keep hearing, I don't have a workforce. I can't get people to come back to school. Well, number one, nurses had to go back to the hospital. Truck drivers had to make sure we had a supply chain. People were working, why are they the only essential workers that can say no? And so, I mean, I'm very supportive of teachers, but there is an inequality in valuing education in the school buildings in comparison to all these other values that we have expressed over the course of COVID. So for all of those reasons, but mostly because I firmly believe in education and the safety of schools for our kids, I've advocated for them to open. And American Academy of Pediatrics, I hope everybody will read it. It's on my website. It's on my Facebook. They said unequivocally and repeatedly, do not let that be an obstacle to opening schools. Do not let that be, not cohorting, not mask wearing, not social distancing, not school buses. Nothing should be an obstacle to you opening schools, because the danger for our children is too great. So I'm sorry I went on so long, but I wanted to hit on all those.
Now, and what we can do is in the chat, we can share that, your website and that link to their article. That would be a great resource.
We'll get that.
Right. So you have been a proponent of virtual learning. What should be the proper role of that if parents are going to pursue that as an alternative?
I am a firm believer in virtual learning. I think that I know that different kids learn in different ways, and that if we really want to seize the talents of every child, we need to modify our education to make sure that they learn in a natural way for them. And that's not all of them sitting on a butt in school listening to a lecture for 7 hours a day. So I've been a big proponent of virtual education. Here's the nuances of what I've proposed for the state that I think are so important. One is that it's universal. So if you look at other states that have adopted virtual education, as I have asked Virginia to do it, there is a single IT platform for curriculum. And that IT platform can be used in the schoolroom, in the classroom, or it can be used in virtual education. That's really important because that provides consistency, which allows us to meet benchmarks of quality. When you have, right now, school divisions are using their own systems. Virginia has made that platform available. We have a small virtual education program called Virtual Virginia. It's been limited by finances to 6,000 kids for the last many years. It was only high school also. We've expanded it to K-12, and that platform has been made available with CARES Act money to everybody in Virginia, but not everybody elected to use it. So now we're recreating the wheel as we go. People learning new websites, people learning new interactions. We know how well that worked in the spring for our kids. So the idea of having a single platform, an example of why that's so important is that South Carolina no longer has snow days allotted in their school calendar because they never have to take them. If their kids are home because there's something that keeps them from going to school, they are nimbly able to translate that to home curriculum, and the kids don't lose any time. Our teachers are sharing lesson plans on Pinterest because there's not a single platform that enables them to share whether what they're using in the classroom or to translate that to home. If you look at all the private schools that succeeded in the spring during COVID, it's because they very nimbly had the IT systems. They're smaller, obviously, they're not a whole school system, but they were able to translate what they do in the classroom to a very similar experience in the home. So when you're talking about virtual education for Virginia, you've got to talk about one thing that's universal, but then you also have to talk about how it can be used in different ways. It can be used in the classroom, it can be used virtually. That's the kind of virtual education I am advocating for. And we don't have it yet. We won't have it this fall. And for that reason, next week, we're going to have some legislation that I'll be bringing forth that talks about how we measure quality on virtual curriculum, because parents are really frustrated. And right now, the state has suspended accreditations for our public schools, and we don't, that means there are no benchmarks they're being held accountable for, so there's no measuring. And so you can't send a message without measuring whether or not it was received. And that's where we are. We have serious quality measures. We have a lot of variability. We have different levels of sophistication. And so virtual education and concept of what I want for Virginia is not what we have now. But right now, no parent within a parents' rights state, and we agree that that is a principle of Virginia that we all embrace, no parent should be forced to say, I have to choose between my kid going to school or not getting any education. So virtual education is a great choice for parents. The problem is the state has deprived parents that need to make the choice for bricks and mortar of that choice, and it shouldn't be compelled to be virtual.
Yeah, there's a lot that I know is coming up in this special session. I know it's not the focus is going to be the budget. criminal justice reform, but this is a major issue that the legislative branch is going to have to take a look at this session. We can get into more in that towards the end. I know you probably scared a lot of kids by saying no snow days, though.
They get to stay home. They just still have to do their homework.
Yeah, right. Well, staying on the virtual schooling, I guess parents may have a concern about privacy. You know, what can be done to ensure privacy when you have these cameras that could be streaming in homes throughout the day? What would you say to that?
Well, I think we all have to be very, very much aware of privacy in this new Zoom reality that we're in now. You know, it's interesting. There was one school division where the teachers were saying we must teach from the schools because when they taught from their homes, they were later targeted for break-ins and thefts, because people could see what they had in their home and they could figure out where they lived. And so it was, so there are real security issues. But I think, fortunately, I think there's a lot of information for parents out there on technology and safety. And you do need to make sure, I mean, I've always kept my, you know, we've all heard those scary stories. I've always kept my camera covered. It's obviously uncovered now. You need to make sure your computer's closed. And if it's a desktop, you need to make sure it's off, or you cover the camera when it's not on. I would by no means be an expert in what you should do, but I would say you should do something and research that and look at what are best practices for home safety with the technology the way that it is. And I could come up with a list off the top of my head, but I think there are probably subject matter experts that could help parents better.
Yeah. All right, so let's kind of look at what some of these localities are doing. So I live in Hanover, and so they're offering, so they're offering sort of a hybrid approach, a modified in-person learning with an opt-in option for virtual schools. They provide parents the opportunity to choose the right learning environment for their children. But what are your thoughts about some of these modified in-person approaches whereby they go to school for 1 or 2 or 3 days and then spend the remainder of the time in virtual classrooms? You know, is there a right or wrong in this scenario?
So let me say first, I think Hanover is the exception in that they're offering 5 days.
Yes. Yes.
And so they are offering 5 days in school and in the school building. And so as a concept, I'm opposed to the hybrid learning. And here's the reason. Just from a medical standpoint, one of the ways when you cannot social distance individuals from each other, which I question whether you can with children, especially young children, you implement instead cohort social distancing, which means you have a group of people who are together, and that group is easily traced if there's a problem with infection, and that group is not commingling with other groups, magnifying their potential exposure. So, you know, just mathematically, if you have children in different locations for 2 days a week and then 3 days a week and then maybe at home the other 2, you are exposing them to so many more cohorts that you're actually undermining some of the best practices we have gotten from the medical experts on how to limit exposure. So I would say when you add to that the idea that this hybrid schedule, so, you know, I jokingly say my medical practice is my personal focus group every week, and I have so many patients that are teachers. They were despairing how they would ever figure out how to manage both their children and their classrooms when these days were gonna, you know, be all mixed up. But there are even challenges with full virtual. I have talked to parents whose school divisions have decided that they're going to have the same blocks all day long. So kids will be have to be on the computer the same 45 minutes no matter what grade they're in, because all the teachers are on then, and then they're off, and then they're on. Well, they don't have 3 computers. They don't have 3 computers in their home if they have broadband. So virtual education works for some people, but it doesn't work for everybody. Hybrid works for almost nobody. And so I think that we need to have an in-school option, a virtual option, and we need to be developing best practices for how we implement both of those, both with curriculum, and educational quality and safety.
Mhm. So I guess that kind of gets to a question of funding. What is the ability to reopen in Virginia all about funding? Because aren't there costs associated with virtual learning as well as getting back into the classroom? Things like internet access, computer access. What would the General Assembly, what can they do to address some of these issues?
So I would say, as we look at the budget, there are basically two strategies for us to deal with the budget as it is now modified by the revenues the state has seen as a result of COVID. And the first is that we protect in the budget things that have been pulled out by the governor. We need to decide what the priorities are for us to protect in the budget. The second piece of the budget equation is, what are we going to do with new spending? And I would say our highest priorities to both protect and determine new spending are how we can make sure healthcare and education are provided the way they need to be now, which includes PPE and rapid testing. But the other is that there's no investment that is more important for us to make right now, but on education. And our kids, our parents are now trying to figure out where their kids can be safely during the school day, because we've taken away the safe place they go, and where they can learn well. And that's costing families a lot of money. And it is money that was guaranteed to be a free education by our Constitution. So for me, any new spending must prioritize supporting families. And, I think we can give the child's deduction for the state taxes in money, in a rebate to families. I think we need to look at earned income tax credit for families of lower income that may not pay all the money in, but they should get the full amount back, because those families are in the greatest jeopardy. Tax credits will be fine a year from now. They're not going to help right now. So I think we need to look seriously at CARES money and any additional money we have in the budget, and make sure we get that to parents, because we have ripped away from them the safe place that their children can be. And now they're going to figure it out. And a lot of kids, I'm guessing, are not going to be safe. And they haven't been. A lot have been home alone, with the oldest family member being 12. And so that's where I think we should be putting the money in the budget.
Okay. So I'm going to ask you to kind of look into your crystal ball here, and in light of the learning environment we find ourselves in, with the growing use of virtual learning, online, some of these hybrid approaches that you've kind of talked about, what does schooling look like in Virginia as we move forward and kind of, learn to get through this coronavirus health crisis that we're in? What is this going to do for education in Virginia moving forward?
Well, I'm never very good at crystal ball, but I can tell you what I think and what I hope for. And I have for a long time, as you look at public education, there are so many challenges that we have the opportunity to address and make. The American dream pivots on a strong education. And there's so much data to point where we have opportunities to make that better. One is zip code data. If you look at the zip code data, as it's called, from VCU, because we tie where you go to school to where you live, people who already have financial challenges and live, say, in government housing or something else, have their children predestined to less opportunities because they are in the weakest school districts. It's one challenge. When you look at kids that have special ways that they learn, or kids that require special education, we have a lot of room for improvement in how we're succeeding there. And I would suggest we're not always measuring success. We don't really measure whether or not kids that are getting specialized education are achieving the benchmarks that they need to. That's a big opportunity there. We have kids that are not able to succeed in the lecture environment that we've created in schools, and as a result may never really have the same opportunities in life. So for me, all of those variables and the fact that our kids have fallen behind in COVID point to a couple specific interventions that we could take that could profoundly improve education for Virginia and our kids. The first is we need to measure every child. And we need to measure that child in two ways. We need to measure where they are on what they know, and SOLs are not the best way to do that. We have better ways. We need to measure where they are, because when you look at a child, you have to see how that child improves. And so we need to know what baseline measurement is. And then we also need to measure, in my fantasy world, how children learn. One of the advantages of virtual education, if we had this single platform, is that it allows you to begin to individualize education. So if you have a card that briefs you on how a child learns, and you're going to talk about, say, the Constitution, you may say these learners are going to do better in a video game learning opportunity. These learners are going to do better reading and writing a paragraph, because that's how their brain works. This group needs to go watch a movie and then tell a story. We can begin to individualize kids, to individualize teaching, so that kids can absorb it in a way that works for their brain, so we can actually accelerate them through the learning benchmarks we need for them to achieve and actually get the outcome that we're all looking for, which is that self-actualization, that participation in society, and all the benefits of being able to get a good job and find something you love, and be able to support your family. So for me, all of COVID adds to that analysis, that we need to individualize evaluation of our kids and individualize education, so that then we keep following our kids and we see if we need to redirect. We have programs like this. Literacy Lab is like this. It's teaching kids to read. They measure them every week. And when kids start falling off the achievement curve, they reevaluate what they need to know and how they're teaching them, and they change it so that they stay on that trajectory of success. That's what I want for our kids.
Wow. All right. That's great. Well, I do have one final question of my own, and this is more of a health/schooling question, and I think that a lot of it's in the back of every parent's mind. Is there a possibility of an uptick of this coronavirus that could put all the kids back into virtual learning this school year? I mean, is there a concern about that this year as we head into the new school year? And I know that's a big question. I know you don't like crystal ball questions, but I think that's in the back of every parent's mind.
No, I think that's a fair one. And that's not as crystal ball. When I say crystal ball, when what's going to happen with education, that is variables somewhat outside of my control, because I can only voice my ideas and my visions. I have to get other people to agree with me and spend money where I want to spend it. So that's why I can't read what's going to happen. In this situation, I feel strongly, I know how to do that, how to figure this out. But my answer to you would be all the questions that pop into my head. Well, how would anybody know? Because no subject matter expert has set benchmarks that we can all measure and follow. So it's kind of arbitrary, isn't it? So why aren't the schools open now? If you look at the template for Virginia Beach that has an actual metric-based template of what they need to have happening based on COVID numbers in order for them to go back to school, Henrico meets those criteria today. Mm-hmm. So the problem with metrics, the reason I feel that metrics and benchmarks are not being shared with us, because it takes the power away from the governor and the agencies to be arbitrary. And what I will be carrying legislation next week that we look at that we look at data, we set the data targets that we need to have. So much of what inflames people and scares them is reassuring data. It's shocking to me. I don't know how to process this sometimes. We're at 7% positivity rate. That's awesome. Other states are at 12 or 25%. We are below 10%. That is what we need to be. Our ventilator utilization rate is at 20%. 20% of our ventilators are being utilized. We can take care of people if they come to us. The expectation that we're not going to have any new cases is fantasy. This is going to be around. There's going to be a certain number of cases, but the state is not measuring or reporting the right data. Right now, as we see that 7% tick along and we see all those new cases, we need to know, to have any kind of reference point for whether or not it's important, who is getting it. Because there's the general public, there's communal living places like jails and nursing homes and group homes. Those are two different relative risks. If you're getting it in a community living center, that's a big danger. We could be in trouble. If it's out in the community and a bunch of 25-year-olds, we probably won't even have any symptoms that they're sick. And so we need to be, this data needs to be reported in a way that is comprehensible and applicable to benchmarks, so we all understand and we all decrease our fear and we all say together, it's okay to go back to school because we're at 7% positivity in Henrico, our schools can open. But we're not getting that. We're just getting this arbitrary. Now we're at 100. How many people have had the virus is the most meaningless metric that exists. And so, so data will be something I'll be addressing next week as well.
Okay. Well, I do have a couple of other questions, but I thought I would get to some of the questions, a couple of them that have been asked by some of the participants in this webinar, if that's okay. Still have a few more minutes. Let's see. The first one says that we are opening in person. Are there ages or grade levels that masks would be inappropriate? And will a cohort we will cohort our classes and are considering masks in those classrooms. I guess, yeah, are there certain ages where you know, maybe it's a factor or not a factor?
I think what I've seen in most of the medical literature is under 2, so it wouldn't really be relevant to school-age kids. I think it would, you know, so I think most of the school-age kids are going to be encouraged to wear masks. You know, the American Academy of Pediatrics said maybe, maybe not. But I think the practical reality is maybe, maybe not, we need to in the cohorts. But the practical reality is if our goal is to get kids back to school, I don't see that happening without us convincing them to wear masks. I had the great blessing to go, this is just an aside, but I had the great blessing to go with my family out to Philmont with the Scouts. And when we were out there, the little kids went hiking and we were at a really high altitude and they needed to keep the kids drinking because dehydration at the high altitudes caused altitude sickness and all sorts of problems. So I would go on hikes with my 6-year-old when she was out there and there were petroglyphs and there were, you know, Indian cave paintings. It was amazing. But every few minutes, the leaders would stop and they'd say, we are going to make a toast. Who wants to make a toast? And they'd say, let's toast the tall tree, everybody drink. So they turned a safety issue into fun. We need to get over the arguing of yes or no. Let's get to yes, and how can we do it together? We can get the kids wearing masks. This isn't as scary as it seems. Let's just accept it and not argue the merits and find a way to make it fun for our kids instead of scary and reassure them, and let's just get the job done.
Yeah. Okay. Let's turn our attention to private education. I know we've been talking about the public schools. One question is, how does the closing of public schools affect the ability of a private school to open in person and remain open? And
I'm so proud of our private schools. I am so heartbroken for all the families that can't afford to send their kids to private school. And I will tell you that what the private schools did in submitting their plans to the governor and to the Department of Education about how they were going to open is exactly what our public school divisions could have, like Hanover did, or should have done. And it's a scary time because the inequalities of private versus public education are going to become very, very evident. And there's probably none of us here that haven't heard the conversation about what happened in the spring between private school kids on virtual education and public school kids. And so we know already that the private school kids didn't fall as far behind, and that they completed their academic work. And we know that they'll go back to rigorous academic work now, in person and online. And I know that all the accommodations are being made, and safety will be foremost. But it is I just, all I can say is what a beautiful time for our private schools to shine and show their commitment. Teachers from the public school divisions have been leaving in droves to go to the private schools, but so many teachers say, I wish I could. I don't know how to balance out my benefits, but teachers want to teach. And the teachers from the private schools that come in, they say, I am aghast. This is our vocation. We are about safety for kids. This is what I do. And so it's going to be a big rift, and I don't know exactly how to fix it, but it's terribly irresponsible from the public system.
Yeah, and a lot of these private schools too serve urban areas, and so they're not the usual private school that a lot of people think about. I mean, they are in service mode. This is a ministry to them to serve many of these communities and help them receive a quality education, I think, and they're financially struggling through all of this as well. I know a lot of them have questions, what can the General Assembly, what can be done to help make sure these private schools don't have their doors closed to many of these thousands of kids throughout the Commonwealth of Virginia?
And I have been asking that question for a while, because it's not just private schools, it's child care centers, and it's PPE, and it's cleaning supplies. One of the things I'm going to try and do next week, and I've been struggling with an economic means to achieve that. In my heart of hearts, there's a part of me that would say, let them have a portion of their average daily membership allotment per diem to the school districts. But that's going to cause more anger, and it will make it harder we won't be able to get it passed in this General Assembly, but it will make it harder to get other things done, because people will be so outraged you won't be able to have a civil conversation. But I feel that's just. So that is where I see this money for CARES Act and the tax credits go to the families. I want that cash in the hands of the families, because they are paying now for tuition and for childcare and for other things. I will be working to see if we can't develop a private-public partnership to make accessing PPE easier and less expensive. It's all private sector now, and that's how it has been historically in the past, and the state doesn't want to do it. They don't want to have anything to do with it, and they haven't done an amazing job. We've had to advocate again and again for mental health care workers and private ambulances and all sorts of other people to get PPE. But I think that's one way to help them as well. But I'm open to suggestion if you guys have ideas. There is a movement for school choice. They will be marching. I've talked with some of those advocates, and they will be marching with the others that are out marching in advocacy for education come this special session. And so, I think that is a reasonable conversation to have right now. And in the fall, in the spring, when we get to session, I'd already vowed I haven't been able to get school vouchers through, but I think what I am going to do, just to mix the bowl a little bit, is offer public school choice. And I'm going to use the zip code data to defend that a kid should not have to go to the public school where they live if we have such scientific evidence to show that profoundly disadvantages them as a social determinant of health. And so I think they're going to have a harder time killing that one, especially with people being stirred up. But I think that's a stepping stone to other things.
Yeah, something like that would be a great addition. We've also got the Education Improvement Scholarship Tax Credit Program out there to provide ways.
That's a great idea, actually, for this fall. Yeah.
So I do have two questions, and we'll wrap it up here. And this one is kind of more of a personal for someone who's written in, who says their child has Down syndrome. Will they be required to wear a mask? And if she doesn't, or if their child is or is not, is that going to be requiring them to stay at home if they can't attend school without wearing a mask?
So, I don't know the answer to that. I probably don't have complete control over the decision, because school boards, I'm going to tell you right now, school boards were not supposed to make IEP education virtual. The Department of Education said that had to be in person. And so that's going to be a battle that the school divisions are going to have to fight with the state, because the state's already gunning for that. I know the superintendent is very concerned about that. So medical excuses to not wear a mask are legit. And so if your child has a legitimate reason to not wear a mask, you need to have a conversation with your school. And I can see very, very likely that that's the case, depending upon where they are, with their Down syndrome. Some would probably be able to pull it off and others not. But what that might mean is that you get individualized in-person education if they can't provide it in the school, but they're supposed to be meeting your IEP. They're supposed to be in person physically with your child, and virtual education will not cut it for IEPs.
Okay, that's good. Hopefully that's helpful to the person that asked that question. All right, so next week, special session. For those that are listening, the General Assembly is going to convene for a special session beginning on August 18th. I'm just going to kind of leave it to you. If you want to add any comments, what to expect, what should people know about this special session, and we'll leave it there and finish up with that.
The one you gave me in the last session. I'm looking for my list to make sure I don't forget things. The first thing that you need to know is that the lack of power for two voices, the fact that Democrats have the majority in both houses and that the governor's mansion, is a terrible liability to a vibrant political discussion. First of all, the governor's kept us away all this time. There's nothing in the emergency code for Virginia that merited him not including the legislature in the conversation on all of these decisions he's been making poorly since we left in March. But having said that, we have been told that there's the possibility that we will be limited to 3 bills. That's it. So that's the robust conversation of liberty that will be happening down at the Science Museum. And that kind of arbitrary small limit might be great for people who are more concerned about their own time than process, but it does not give us the opportunity to have a conversation about all the serious things we need to talk about. So that's one concern that I have. The other concern is that rumor has it, so this is not in writing, obviously, that the governor is going to hand down a budget on the 18th, and it is going to come to House and Senate intact, and no member budget amendments will be entertained unless they are tied with a piece of legislation that has a funding stream and passes during the special session. Well, that's going to be all Democrat legislation, right? And so I'm very concerned that ideas with enormous merit for Virginia, like how do we help people who are paying now for their child to be somewhere safe, will be cast aside for political reasons. So that's one thing. But the other things that I'm doing, from an optimistic standpoint, if I really want to contribute to solving the problem, I'm going to have that conversation about how we report data and how there are benchmarks we can compare to, so we can all invest and be reassured by whether or not we hit those benchmarks. We're going to look at paid leave for teachers, because I do think we need to recognize teachers are going to be frontline advocates for us, and we need to make sure they don't have much vacation time in public or private school. So if they have to be out for COVID, we want to make sure they have that time. We want liability protection for businesses, for schools, and for higher education. Who knows where somebody got COVID? If we're going to get caught up in a bunch of litigation about I got COVID there, that's going to be a big problem. That's a huge obstacle opening schools. We've talked about the tax credits. We need to work on preserving telemedicine and making sure it's robustly supported because it's making a difference, and telehealth as well for mental health services. Rapid testing is a reality. It needs to be accessible, and it needs to be accessible to all the essential workers. Teachers need to know if there's a kid in their classroom that has it quickly, not in 5 or 7 days. Same thing for hospitals and for first responders and everybody else. So those are some of the things. Some will be budget amendments, but we're trying to figure out strategy now based on the rumors we hear, so that we can best present our ideas, have a robust conversation, and make a difference for people who need to have a voice. That's where we are for next week.
Well, great. Well, we have certainly taken up a good bit of your time, but we so appreciate your thoughtfulness on this issue of education. And hopefully this is going to be a great resource for parents, for private school, parents of children in public and private school, that I know that it will be. And we appreciate your attention to the General Assembly. And please know that we will be praying for you and your colleagues during this time as well. And here at the Family Foundation, we will certainly be following all the legislative activity that is going on. So I just want to say again, thank you, and I hope that you have a wonderful afternoon.
Thanks, Todd. I hope you all do as well. And thanks for the time. I enjoyed talking with you.
Thank you.
And with that, I'm just going to kind of close us out here. What an amazing conversation, full of information for folks to be able to really get the best information possible for how we address this thing in schools and what is the best way. And they have a daunting task next week when they go back to special sessions. Senator Dunnavant is the only doctor in the Senate. We hope that she is listened to, but they are struggling under one-party power rule, where we saw this during the General Assembly, and we're seeing it in the off session, and we're afraid we're going to see it again in the special session, where Democrats will drive how many, how much, what the discussion level is. And unfortunately, the best outcome for Virginians is when there's a robust discussion with ideas that come from all parties that work through to great, nuanced problem solving. And that's what we want to see next week. I know that you are with me on that. We are concerned about the governor's budget and what will be in there and the limitations on their ability to improve that budget. So Family Foundation, we will be keeping you completely zoned into that process. And most of all, I think we're thrilled, and I certainly heard it from Senator Dunnavant's remarks, we're thrilled that sometimes in hard moments like COVID, good things can emerge. And we do hope that in this difficult moment, some folks see the light with regards to the fact that education is not a one solution fits all for sure in the building that you are assigned to by your zip code. We've been saying that for decades. We've been a leader on so-called school choice. And I say that because people have images that go with those words, school choice, and it may be good, it may be bad. I think Senator Dunnavant speaks about it so well because for some people, they might think, oh, this is just about people of faith pulling their kids out of public schools. Maybe for some people that is what it is, but for a lot of folks, it's simply the local public school I am assigned to is not meeting my need for a variety of reasons. And we're seeing that that is happening in COVID, where the need is not being met either for in-person education or for an IEP or whatever it might be. And that is why we believe God has created every child uniquely. It is challenging to figure out their unique giftedness and then teach to that. And we certainly don't expect that that can be done for any kind of child in any kind of situation, learning style, etc., in the backyard school for sure. And that's why we've always been an advocate for school choice, and certainly going to continue to advocate for the tuition tax credit program that we were able to put in place in Virginia, and anything else that we can do to widen the ability for anyone of any income to choose the best school situation for their child, virtual, public, private, faith-based, secular, you name it. That is the dream for everyone, to have the equal opportunity in life that we think education can bring when it's done well. So with that, I'm going to wrap up and say thank you so much for being a part of today, and we look forward to connecting with you on future VIP chats.